started the recording, and then I think Marcel's going to let everybody in at 9. Good morning, everyone. We're going to be getting started at 9:02, just to let everybody join in.
Interesting.
Morning, everyone. We're going to get started in just a minute, just making sure everyone has time to join. Okay, it looks like the lobby has slowed down, so we'll go ahead and get started. And my slides should be on the screen, so if you can't see them, let me know. But, okay, so hi everyone. My name is Lindsay Bondyke, and I am a program specialist within Behavioral Health Benefits Coverage Unit with Nevada Medicaid. I am over outpatient and rehabilitative treatment services. Thank you all for attending today's public workshop on behavioral health training clinics. As a reminder, this workshop is being recorded, and the slide deck and policy drafts are posted on Medicaid's Public Notices webpage. The Behavioral Health Training Clinic service model was brought about by Senate Bill 353, which was passed during Nevada's 83rd legislative session. For this service model, we are creating a new Medicaid Services Manual, MSM chapter. This will be Chapter 4500, titled Behavioral Health Training Clinic. We are also creating a state plan amendment, or SPA. Today, I will review both MSM 4500 and the SPA. There will be time for public comment at the end of my presentation. To get us started, I will go ahead and pull up MSM Chapter 4500 to review the new policy with you all. So I'm going to stop sharing my screen and transition over to the policy. Okay, the policy should be pulled up now. So displayed on the screen is the new MSM Chapter 4500 Behavioral Health Training Clinic. I will go through each section briefly to provide an overview of the chapter. Starting on this first page, the chapter title and authorities are listed. Section 4500.2, Overview. Behavioral Health Training Clinic, or BHTC, is a service model operated by Nevada accredited universities under the direction of a licensed physician. The two functions of the clinic are providing behavioral health services to Medicaid recipients and providing supervision, training, and education to behavioral health trainees. The supervision, education, and training provided to the trainees must be directly related to the requirement to obtain behavioral health licensure, certification, or registration. The clinic and its providers are required to abide by the university and degree program's policy and procedures, as well as maintain accreditation while enrolled as a clinic with Medicaid. 4500.2a, documentation requirements. The clinic is required to maintain a contract with the trainees. The contract will include the trainee's assigned licensed professional supervision requirements, practicum or internship learning activities, professional competencies, and program requirements. This will be maintained in the trainee's file and produced if requested by Medicaid. 4500.2b, required documentation for the recipient's records are listed, and these must be kept in accordance with documentation standards set in MSM Chapter 100 and 400. All documents must be signed by both the trainee and their supervisor. 4500.2b, supervision requirements. Supervisors are licensed professionals and must be appropriately assigned to a behavioral trainee based on the supervisor's scope of practice and licensing board requirements. Supervisors assume responsibility for their trainees and must review and sign all trainee documentation. 4500.2c, eligible providers. The clinic team consists of a clinic director, licensed professionals, and behavioral health trainees. The clinic director must be a licensed physician who provides behavioral health services and is practicing within their scope. The director's duties are listed and can include providing medical direction and supervision, as well as periodically reviewing the clinic's policies and recipient records. The licensed professionals will operate as the supervisors and will provide supervision, education, and training to the trainees. The behavioral trainees are seeking licensure, certification, or registration as a behavioral health professional and are engaging in supervised practice. They must hold a bachelor's degree and be supervised by a licensed professional. A trainee can either be a student actively enrolled in a behavioral health program working to obtain a graduate degree, or a person who has completed academic requirements and is now obtaining hours of supervised practice. 4500.2d, eligible members. Eligible members are diagnosed with behavioral health disorder and have been identified by the Behavioral Training Clinic as having a documented need for behavioral health services. 4500.2e, covered services. There are two service types for this clinic, non-medical and medical. The non-medical services include behavioral health assessments, individual therapy, group therapy, and case management. Medical services include all of the non-medical services, as well as evaluation and management services. Medical services are intended to be provided by a trainee seeking a license as either a psychiatrist or advanced practice registered nurse who provides psychiatric services. 4500.2f, non-covered services. These can include but are not limited to non-evidence-based practices, documentation, and transportation. 4500.g, authorization requirements. The non-medical services can be used for up to 18 units for adults and 26 units for children annually before prior authorization is required. This is to align with our other mental health therapies limitations. The medical services do not require prior authorization. 4500.h, billing. The medical billing code is H0037 with a per diem rate of $159.80. The non-medical code is H2020 with a per diem rate of $102.62. Both codes include the supervision, education, and training provided to the trainees. The final section, 4500.I, includes information for managed care members. This concludes my policy review, so I'll now switch over to the state plan amendment draft. We intend to add the behavioral trainees to our provider grid located in SPA Attachment 3.1a, page 6a.7, as shown here. The qualifications and services provided mirror the language used in the MSM chapter. It is also noted that the trainees must be practicing with an enrolled behavioral health training clinic. We also included a service model description for the clinic itself. This language will live in SPA Attachment 3.1a and also resembles language from MSM 4500. Before transitioning back to my slide deck, I wanted to make a few additional notes. The clinic will enroll as a group specialty under provider type 14. The specialty number will be determined at a later date. The group will require a unique NPI and individuals will not be allowed to link to the group. The effective date for these changes will be October 1st, 2025, pending CMS approval. I'll go ahead and move back to my slide deck now. So I'm going to stop sharing, transition back. All right. Okay, so my slide should be showing again. This concludes my presentation. We have the remaining time for public comment. I do want to mention that we are particularly interested in feedback regarding the authorization requirements, if there are any. So with that being said, do we have any questions or comments at this time? I see one hand from Kenneth McKay.
Hi, yes, I do have a question. We have a clinic that is um, it's a training site for UNLV. We're not a university, but we are a training site for the university, and we have to make sure that we uphold ACGME standards at our site. And what we do is approved and reviewed by UNLV, but we're not ourselves a university. And so I'm wondering if we fit into this model. We have a program letter of agreement signed by UNLV, and we pay UNLV a fee to be a training site, and we do all the things listed here, but we are not an accredited university. So I'm wondering how this fits in.
Thank you for that question. I think that's a really good question. As far as I know, the way the Senate Bill 353 was written, it does have to be through an accredited university. So that's my understanding, but I will look into that further for you, and then I can follow up with you just to get you a specific answer for your specific clinic, unless I saw Sarah come off camera, unless you have additional feedback.
Yeah, thank you so much,
Mm.
Lindsay, and thanks for the presentation. And Dr. McKay, this may take some more discussions. I'm wondering, would you have individuals that would qualify as a trainee, or do you currently have licensed interns working there?
A little bit of both. I mean, we have licensed physicians, so the folks that we have, they are licensed physicians. We have medical residents from UNLV alongside fellows, right? And so, I mean, all those things are happening. The interns are typically for mid-levels, right, who are doing master's level training. So we have those folks too but those, it doesn't look like that's intended to be covered here, like the master's level therapy and individual therapy and stuff like that. But if it is, we're also registered with UNLV's programs there to do that type of training. So I am if we fit, great, and if we're not fit, then that's okay too. And I'm happy to jump on a call offline with anybody who may be able to help us sort through that stuff.
I think that probably would be our best game plan, to really kind of dive into some of the requirements. I think that sounds great. So we can reach out to you and get something scheduled so we can really look through the weeds.
Great. I appreciate that.
Thank you.
Perfect. Thank you, Dr. McKay. And then I see Dr. Paul's hand. And I believe you're muted, Dr. Paul.
Thank you for that. Good morning. I have
Good
a
morning.
couple of questions raised by a couple of folks on my team. So the bill language talks about a mental health provider or a mental health person is as licensed. Yeah, mental and behavioral health professional means a person who is licensed by a number of different chapters. And as of this last legislative session, the Board of Psychology also will be licensing behavioral health and wellness practitioners, which are at a bachelor's level. So I don't know if this needs to also accommodate that particular type of trainee. And by definition, if they were at a university house training clinic, they would be pre-bachelor's degree. So it's just something to think about. And then someone also asked about the units, the H2020, what the units would be, half hour or 1 hour. And then you were asking at the end of your comments for more information or questions about authorization requirements. Could you expand on what you were wondering about?
Yes, of course. And to address the units question, so those will be per diem codes. So it's the service is rendered throughout the whole day. So it won't be based on half an hour, just be per diem for that one. And then, yes, the authorization requirements. So right now we have it set up where the non-medical code will allow for 18 units or 26 units per year before an authorization is required. And then for the medical codes, we're as of right now, we have it set at no authorizations required. So we just wanted to get stakeholder feedback to see if that accommodates what you think might happen in the real world, or if maybe there's some adjustments that we need to make. That's just something we've been discussing internally, so we wanted to get more external feedback and see if there are any thoughts on that piece.
And to follow up, that is in alignment with what is currently happening in behavioral health with respect to prior authorizations in the non-medical space, right?
Yes, that's correct. Right. We just switched that, I believe, pretty recently with the mental health therapies. We aligned those where it's going to be 18 units, 26 units for adults annually. So we wanted to align that here as well. And then for the medical piece, we also looked at the E&M codes, and those don't currently have prior authorization. So we wanted to align there as well. So that's where we pulled those numbers from. Yes.
And one last question, you were saying something at the very end that these training clinics would enroll as a group specialty as provider type 14. Could you say that again, just that last piece?
Yeah, of course. So this is going to be under provider type 14, and it'll be just a group enrollment. And we're currently on the internal side developing that specialty. So it'll have a specific specialty number, and that's what the clinic itself will enroll as. And they'll just enroll as a group. So we won't have individuals linked to that group.
Right. And then I will follow up on Dr. McKay's question. So I was involved in working with the senator on drafting SB 353, and the intent behind it was to keep it aligned with university-based, university-operated training programs for a variety of reasons, not the least of which was to keep the fiscal impact, I don't want to say minimal, but keep it restrained in order to, this was a very, very tight year budget-wise. And the idea was to hopefully keep it contained so that this could move forward this legislative session.
Thank you for that perspective as well. I appreciate that. I think that'll help us in our conversations with Dr. McKay. Thank you.
Mm-hmm.
Okay. And then I see Donisha, you have your hand raised as well.
Hi, yes, this is Donisha Powell from Silver Summit Health Plan. So we have some macro level social work students. We don't bill Medicaid at all, but I just wanted to see how that would fold in if they're, working in that capacity with the health plan. Would we be excluded from this, or is this something where, potentially we'd have to limit our practicum students to just bachelors?
That's a good question. So I believe my understanding of how this is created, the students will have to be working at this specific training clinic that is at the university. So if the macro level social workers are a part of that clinic, that would be allowed. But then again, as you stated, they kind of do different services outside of the therapy services in the micro level of social work. So I can follow up with you on this as well. But the students would have to be participating in that clinic, and I believe those clinics their operations will be to do the therapies. So I don't know if they would fit into that, and especially on the bachelor's level, I know that was the question brought up with Dr. McKay as well. So I can follow up with you on the bachelor's level piece, but it would be my understanding that the students would have to be working at those clinics that would be providing the therapy services. So I believe that would be outside of the macro world.
Okay, all right, thank you.
Thank you. And then I see one more hand raised. Shanika, I believe is how you say. Sorry if I
Yes, that's
mispronounced.
correct. Nope, you got it right. This is Shanika with Anthem. Wanted to find out, when do you expect to have that specialty type?
Um, I would hope soon that this is something going on with our systems update. So it goes through Gainwell, our fiscal agent as well. And then they'll provide us with that specialty number. As soon as I have that, I can definitely get that information out to the MCOs. But I don't have a distinct timeline on that right now.
Okay, yes, because we will need that to be able to properly configure our
Definitely.
systems.
Okay.
Thank you.
I'll make a note. And like I said, as soon as we get that number, I will pass that out to the MCOs. Thank you.
And Lindsay, I think Shanika might have been alluding to like, what's your effective date?
Okay.
So, and I don't have it off. the
No,
top of my
Lori,
head.
sorry, I understand the effective date is
Okay.
October 1st. I just want,
Okay.
without the specialty type, we're unable to properly configure to be able to pay. So we need that as soon as possible.
Okay, perfect. Thanks.
Thank you.
Okay. And then I see Julia.
My question is, I come from a pretty uninformed on this particular topic. So are there,
Julia, we're not hearing you. Like, you're really far away.
is that better?
Yes, that's much better. Thank you.
You bet. So I come from a pretty uninformed space on this one. So I'm just looking more for the basic question. Are there clinics that are currently operating at the universities serving patients and they just don't have a reimbursement model? Or this is intending to create something new in our state that would have to be built from scratch by those universities?
So it's my understanding these clinics are already operating at the universities. They're just not currently being reimbursed. But I do see Dr. Paul raised her hand and she's a part of one of these universities, so she may be able to better speak to this. But it's my understanding that these clinics are currently operating, but because the students are licensed or have that internship level license, they are not able to currently bill. So this would allow them to be reimbursed for those services. But Dr. Paul, I don't know if we're wanting to respond to that as well.
You did a great job. I'll just reiterate that yes, UNR, UN, and UNLV, and Nevada State all have training clinics. And in order to, this is really a workforce development bill, because our sustainability is hard when we are operating under a model where we are not reimbursed in a way that also supports the time and effort that goes behind training. So it's a combination of well, it's really about supporting the additional time and energy that goes behind providing quality training at the existing university-based and operated training clinics.
Great, thank you, super helpful.
Yeah.
Yes, thank you, Dr. Paul. And then Dr. McKay?
Well, I just wanted to congratulate everybody on such an accomplishment. I think it's a really great step and it's in line with where we want to go. I hope that it's just the first step and then it can continue to expand, because the outpatient training sites that are not like, we're affiliated with the university, but we're not a university, we're incurring all the same expenses, right? And when we don't put training ahead of service delivery and other types of things, we hear it. We hear it from the university, right? Because the students will say, oh, they're making us be so busy, and so we're required to lower the amount of billable work that trainees do out in the field with us, and it makes it really difficult to operate. And so I'm making my case for the expansion of this type of effort to support exactly what Dr. Paul just said. Is we're supposed to be really focusing on training and not billable output. And this type of bill makes that possible for UNLV. So I congratulate you guys. And I volunteer to be someone who helps spearhead this type of effort for outpatient clinics that are affiliated with the university.
Thank you for that, Dr. McKay. Appreciate that. Okay, I don't see any other hands at this time. Are there any other questions or comments? Oh, I see the question about the proposed rates. I can definitely put those in the chat as well, just so we have those written down somewhere. And then I'll also go ahead and pull up. This is my contact information, so if you have any other further comments or questions that come up, please feel free to reach out to our behavioral health inbox, and I'll be able to further assist you. But that concludes my presentation, so thank you all very much for joining us today. I'll put those rates in the chat. And I also see Dr. Paul's additional comment. Thank you for that. And yes, please feel free to continue to reach out to me if anything else comes up. I will take all the input and feedback. I appreciate it.
And Lindsay, I just think it's important to note that we are looking to take this to public hearing in December. So we're looking at the end of December for public hearing on this. But we'll continue to have discussions with the stakeholders as we work through the details. And I think it's also important to note that all of our policies are living, breathing. So like we're like, to Dr. McKay's point, like it's a very valid point. So like, how can we move the needle forward? And so even if we push it through in December and we have changes to make, like we can still do that. Keeping that in mind, like it's not etched in stone. We have the ability to move forward and evolve with the policy.
Yes, I agree. Thank you, Lori.
Mm-hmm.
Go ahead and stop sharing. Thank you all so much again. Have a good rest of your day.
Have a great day.
Thank you.
Thank you.